Are you a woman standing at a crossroads, eager for change? It's time to connect with your authentic and empowered self at Boss Leap. Join Dr. Sylvia Morris and Dr. Angela Walker in this empowering community where real-life stories of courageous and talented women inspire and motivate. Engage in honest conversations that foster well-being, drawing from our own journeys. Let us guide you toward profound growth and transformation in both your personal and professional life. Here are your hosts, Dr. Sylvia Morris and Dr. Angela Walker.
Welcome to Boss Leap. My name is Dr. Sylvia Morris, and I'm here with my co-host, Dr. Angela Walker. And today we had an exciting conversation with Kristin Wagner. Kristin is a middle child. She was a swimmer turned marathoner, a nurse and nurse educator, along with being a mother and a wife. Kristin's conversation, she brought to mind and reminded us that all people are human and deserve compassion. And she also reminded us that special people with special needs have special talents that we just may not be aware of.
Yeah.
Angela, I so enjoyed our conversation with Kristin. We
awesome.
did some rapid fire with Kristin, which is a new segment that we're going to add to Boss Leap. And we would love for our audience to comment at bossleappodcast@gmail.com with any kind of suggestions for rapid fire. So I'm going to give you the honor of starting the rapid fire so that our audience can better get to know us. So what you got for me? I'm ready.
Are you ready?
I'm born ready, girl.
You are. Some of these I already know. Sushi or steak? Let's say Wagyu.
Oh, wow. Okay. Can I go back to Nobu? Because if I can go Nobu, I'll take sushi. I would prefer sashimi.
Okay. All right. Caribbean. No, I'm talking about oceans here because I can't give you Atlantic or Pacific because I already know your answer. Caribbean or Mediterranean?
Oh. Mediterranean because I have been. I went to Marseille. Yeah, I think it's Mediterranean because I just haven't explored it enough. Oh, that's a good one.
Not so.
Okay.
Wedges or stilettos?
Both.
You can't do both. You do both. Last one, Michael B. or Idris Elba?
Oh. That's not even fair.
I guess you asked me to bring it.
I mean, Idris is, married, so that knocks him off.
Okay.
But he's age appropriate, which is great.
Well, we're saying they're not married, and you're not married yet.
You can't force me to choose. Someone may get Michael B. Jordan may get wind of the fact that I chose Idris, and Idris, when I see him, he'll be like, "Oh, girl, you couldn't choose me." So. Yeah.
Woo, okay. So, all right. Next time you got to give me an answer, but I'll give you grace. Okay. It's your turn.
Thank you. So your questions were a lot better than mine. I'm going to tell you. I am going to steal yours and say Mediterranean Sea or Caribbean Sea.
Then I'm going to steal one of your answers in both because there's so much of the Caribbean I have not seen. I love everything about it, but I haven't been to Mediterranean either. And that's on my bucket list. So I'm going to have to say both. You could give me all the oceans and I'd say all of them, but those are the...
Absolutely. Next. Sushi or ramen?
Sushi. I thought sushi.
Yeah. Okay. I like the definitiveness. And then organizer. So we already know that you use a lovely organizer that is paper and it's got the tabs and all that. So you want an organizer. There we go. With tabs or organizer with a packet of 5 highlighter colors so that you can highlight and do your
tabs for the months. And then I need a separate tab for the days, the week that I'm on.
Okay. All
that one that I can, yes.
Okay. That's all I got for you. But we are going to continue this segment. And the next voice you hear will be Kristin Wagner. Welcome to Boss Leap. My name is Dr. Sylvia Morris, and I'm here with my co-host, Dr. Angela Walker. And today, y'all, we are in for a treat. I know every week I say this is one of my favorite persons. It really, really is. We have Kristin Wagner today. Kristin is a nurse, a mother, a wife, an educator, a fellow Southern Californian. Kristin, welcome to Boss Leap.
Thank you both so much for having me. I fangirled when I of course know Dr. Morris, but meeting you, Dr. Angela Walker, in person,
anyway,
it's fantastic. Fangoing a little bit because I've been listening since day one.
Oh, we got a day one.
You. Yeah, an OG. Thank you so much. Well, I've heard so many wonderful things about you, and definitely Sylvia, as a true Southern California girl, it didn't fail to mention that that's where you're from. And also, I understand that you're a marathoner. Never made it to that point, but she knows my love of running. So we just like to start off just by knowing a little bit about like what made you. What was growing up like in Southern California?
So I grew up in an area called the Inland Empire. We were the 714, then the 909, and then we became the 951. So
the IE.
The IE, yes.
Okay.
Kind of tucked away 30 minutes from the beach, 30 minutes from the mountain, in a little valley there. Very diverse, very diverse, very Latino. Neighbors and families and friends. And I don't know, Dr. Morris, if you're familiar with the Mission Inn in downtown Riverside, but I lived there for, I was born and raised and lived in the Mission Inn area of Riverside for quite some time. It's very Spanish revival, very old, beautiful homes. And then my family moved in next door to my dad's parents. So my paternal grandparents, when the house next door went up for sale. So when I was 6, we moved in next to our grandparents and lived there for a long time until about middle school. We ended up moving.
And now that to me sounds like a wonderful experience. I'm just curious, was it as I'm imagining?
It was. I had, very, middle income, normal upbringing. My parents are high school sweethearts. My dad's from Long Beach. My parents' family is from San Pedro. They met in high school.
South Bay.
Yes. Yep. They ended up getting married right out of high school, have my sister, me, and then my brother, all 2 years apart. So
oh my goodness.
Very close family. Weekends at the beach, weekends at the mountains. Very involved in sports, so lots of sports as well, kind of to fill our time.
That sounds like a beautiful upbringing.
Yes,
it does. We're family on this podcast. So I'm Dr. Morris at work. Please, I'm Sylvia, and this is Angela.
Absolutely. I'm Angela all the time, so it doesn't really matter for me.
It's so hard for me because it comes from such a respect level to address you by doctor, but okay, I will try my best.
That's like old school nursing. I love it. I love it.
It is.
But actually, that's a great segue. So tell us what drew you to nursing. And I will share that my mom was a nursing instructor at Compton Community College. So I'm a big believer in a community college system. In particular in California. So can you share your journey with us?
Yeah. So this is a safe space. So I'm just going to be open and honest and share. But I was a young mom. I was not, nursing was not even in the forefront of my mind. Vomit, blood, traumas, broken bones, not anything I ever wanted to deal with. It was not in my wheelhouse. I did not ever want to do that. But after becoming a mom at such a young age, I had, my dad had approached me and he said, you have such an empathic, kind heart. I really think that nursing would be something that you would be great at. And he's a firefighter. And, when you take patients into the hospitals and all those things, he's always really admired nurses and, kind of knew that maybe that would be a path that would be good for me because quick work, get out there, go to community college, start working within 2 years and be able to make a good life for myself and my child. And that's what I ended up doing. So I went to Riverside City College. I also am a huge proponent for community colleges. It's, I know everyone touts the 4-year journey, but community college is fantastic. And Riverside Community College had a 98% pass rate on the NCLEX test. And so
huge.
I could not.
That is huge.
Yeah, it was great. I was really glad that I went there for my associate's degree.
Yeah. Glad that you both are bringing up the community college route. Because I have to admit from, going to a 4-year university and it was never in my radar. Growing up, I didn't even know anything about community colleges. My husband went to, started off and then went to a 4-year university, and I didn't truly have an appreciation. I did some summer classes when I was undergrad, but there are so many avenues out there, and I don't think you really appreciate that I didn't really appreciate it until being a mother, because you always think, one way. But there are so many other avenues, even, trade schools and things like that I don't think we talk enough about. And so I'm glad that you are able to shed some light on that route, because clearly you are where you are now because of it. So thank you for bringing that up. Do you mind sharing with us how old you were? Because I love the stories about moms that, maybe become pregnant early, or for whatever reason, it changed kind of their path, but still went on to pursue dreams. So,
so I got pregnant the fall after I graduated high school. So I made it out of graduation. I ended up getting pregnant that fall right after. So I was 18, and then I had Bradley, my oldest, who's going to be 22 soon. I had him just 13 days shy of my 19th birthday.
Oh, wow.
Beautiful. Yeah. Tumulus at the time, scary. Thought my life was over, but we make it through with a lot of support, So I'm very thankful for that.
Very cool.
And what would you say to your 19-year-old self now, if you had the opportunity to encourage her or to just sort of pour into her? What would you say to her?
Well, besides the obvious, babies shouldn't be having babies. Besides the obvious, even after that, I would say that there was a major self-confidence issue. Growing up, looking back, just a major, just didn't think very highly of myself. And I don't know where that comes from, but looking back, I just wish I could hug myself and people, like me, and just, make myself realize that, I'm worth it. I deserve space in a room. I'm smart. I'm capable. All of those things that we might not think about ourselves when we're younger, but looking back, just knowing that I was capable of so much more than I really gave myself credit for.
Absolutely. It sounds like great advice. I wish we could all use that when we were at that age.
Right. Because I think it's a normal thing to have, levels of, we don't always have a ton of self-confidence. And I don't think we talk about that enough, especially as women. We're supposed to hold ourselves up and really promote this, this power. But we always have these feelings of maybe not measuring up or not being good enough. And we don't talk about it enough, but I think it's a little bit more normal than what we realize.
Mm-hmm. So switching gears a little bit, you also mentioned your dad, and we always, we tend to find this common thread in a lot of our interviews. It just takes that one person to say the one thing that can sometimes direct your path. And it's a blessing to have someone that sees something in you that you may not, you don't have enough life experience to know that, oh, okay, that's an option for me. So bravo to your father. And now you are, I understand, a nurse educator. What do you enjoy about that aspect, having come from, a nurse that was, educated young, and now you're one of the educators? What do you enjoy about that?
Well, I first started, before I went back and got my master's, I was a clinical instructor. So I would go to the hospitals with about 10, sometimes 15 students, and, spend 12 hours on the unit. And I just loved being able to show them how things work outside of the classroom, where sometimes it's a little bit more hectic and there's a lot of students, and sometimes they don't get that one-on-one time. I loved being able to show them in a calm, understanding, patient way how things work, and then just it clicking for them, or it making sense. And then the next day they'd come back to clinical and tell me, oh, I did great on my test because I thought about when you said that, and those types of things. So I did that for about 4 years before I was encouraged by the faculty at the college I teach at now to maybe transition into didactic. And it's very different, a little bit scary. Sylvia helped me with the music and the cue cards. She says, play music.
Yes.
And have some cue cards, because it can be a little bit overwhelming.
Yeah.
Mm-hmm.
But honestly, what I like so much about it too is that it keeps me I'm always learning more. I have to keep myself educated. I have to keep myself aware, because I don't want to set them up for failure. And it helps me stay fresh and keeps me new.
Very good.
And Kristin, I have to say that whenever I work with you, I know that the patients are going to be well taken care of. And your even-handedness and just that internal calm keeps the area calm, and it makes it so much more enjoyable to work. I mean, we always have a good giggle, but as far as our patient care, I know why the students gravitate towards you and why they requested that you become a didactic instructor is because A, you're knowledgeable, B, you have fantastic communication skills, and thirdly, you care and you can feel that. So I'm super excited for your journey as a nurse educator. We know that we need more nurses and that the nurse educators are aging out and retiring. So I just wanted to say bravo, and I'm rooting for you, and I can't wait to see how this evolves.
Well, thank you so much. It means a lot coming from you. And I have to just give it right back that I have to say that you were really the first provider that would sit at the desk with us. Dr. Morris sits at the desk with us nurses, and
that's where all the tea is.
Well,
you find out everything. I mean, you find out about the patient.
There's options. There's options where you can be tucked away if you want, but Dr. Morris is right there and communicating with us. And I mean, you were really. had been a nurse for 15 years before I started where we are now, and you're really the first doctor that's ever done that. So
wow,
it definitely struck a chord with me. So I appreciate you very much.
Well, thank you.
That's
but it's
beautiful.
Also
Take your flowers.
Small space. So it would be hard to be separate when you're right there. And I'm already ear hustling. But anyway, that's for another kind of conversation. But since we're talking about this, you've done lots of things. So help us understand how you know how to pivot. So you pivoted from, I'm going to just mention, I read your bio, which is so moving. But you were going to cosmetology school, and then you pivoted to nursing, and then you pivoted from being in Southern California to living here in the Atlanta area. Talk about your thought process around that.
I would say at heart, I am a dreamer. So I really put the thought in process before I really even put the logistics in order. Yeah. And thank goodness I'm married to a practical thinker, because my husband, Kevin, definitely keeps me in line. I come up with all kinds of, oh, I want to do this and I want to do this. And sometimes he kind of has to keep it a little more even keeled, but I want to do so many different things, but I have to keep in mind my responsibilities as a mom as well. So for me, cosmetology school was at the very beginning. That was before I even went into nursing. There was a time I think maybe 2 years ago, I thought about maybe going back. I went to orientation and I was like, man, I am old. I was an old lady amongst these cute youngsters. So,
but you always have great hair.
Well, thank you.
Beautiful. Yes.
I ended up not doing cosmetology 2 years ago. And I was like, well, and that's really when I stepped into the didactic role of education. So when do you know when to pivot? I think when you have this restlessness in you. And you know that maybe you're meant for a little bit more than what you're doing now.
Yes.
And then you just got to put those steps in motion and follow through.
Yeah. What I hear is, although that cosmetology, the love of cosmetology was there, it wasn't necessarily the fire anymore, because clearly you were someone that can go back and educate, and you have this lifelong love of learning. So if it was truly that calling at that moment, it sounds like you might have actually done that, but you were actually following, this thing of something greater in terms of education or nursing education, if I'm hearing that right.
Yeah. Yes, you are correct. Yeah. This is 100%. I feel like I am on the right path. I know I'm on the right path because
very good.
I just feel good. I feel good where I am now.
Cool. So speaking of feeling good, can you tell us a little bit about what you enjoy about running marathons? I'll just have to live through your voice and your eyes, because I don't think I am definitely at this stage going to say I probably will not be able to run a marathon in my future, maybe something less than that. But I admire those that are still out there doing it.
I haven't run any marathons since moving here to Georgia about 4 years ago. But there's something, and I'm sure, because I know, Angela, that you like to run, and you have that runner's high. Have you heard of it?
Yes.
You just get in this space where you just flow. You just run, and nothing hurts. You don't feel winded. You're just running. And
yes,
I think that a lot of healthcare providers are drawn to running because we're alone. And whether or not we have music or a podcast or a book in the background, you can really lose yourself in your thoughts. It's almost cathartic to be out there. And then the marathons were fantastic because they're in areas like LA and San Diego. There's so much sightseeing. Where I with LA traffic, I was never going to be able to get those places in my car, but on foot. And that marathon, I got to go through some of the coolest places in LA during that run. So it was fantastic. I really enjoy it. I recommend everyone at least do a half marathon in their lives, but a full marathon is a bit lofty, but half marathons are just as great.
That could potentially go ahead. So
I'm like, at what point do I get the runner's high if I do a half? I'm like rubbing my knees, just sort of thinking about it.
Yeah.
Yeah, I can tell you for me, I was doing a 10K. For me, Kristin, I guess the roadblock to me ever doing a marathon was I got in the flow, as you mentioned, thinking, oh, I can do it. Yeah, 10K. And it felt so good until I got home.
Yes.
Because I had not done that distance before. And I was just out in the neighborhood and it just felt so good. Nothing hurt, as you mentioned, until the next day.
Right.
Right. Then I was out. So you tell us what you recommend.
I recommend not just going out and running a marathon. That's for sure. I recommend, taking some months, to lead up to it. So you definitely have to go slow. And I recommend doing a couple of half marathons. And I would do half marathons and not even be winded. I was like, this was great. I did a marathon one Saturday, and then the next day, Sunday, I did a half.
Wow.
I did end up with some injuries from that, but just the proper training. I could not do that now. I don't even know if I can run a mile.
Yes.
From deconditioning, but it is possible. You got to give yourself time.
Wow. Very good.
Wow. So you mentioned you have a brother, you have a brother and a sister.
Yes.
And just sort of being the protector of your brother. How has that shaped you?
Yes. So my brother David, he's a little over 2 years younger than me, was a quote unquote normal, you would say, up until about 5. I would say kindergarten. He had little quirks and those types of things growing up, very animated. But not until the age of 5 did my parents and myself, really recognize that there were some changes. He would do these things where he would like pinch us, and if we didn't say "ow," he would wonder, if we were real, if we were robots, like these paranoid thoughts. Yeah. And of course, with schizophrenia, typically you're not diagnosed until you're a young adult or older teenager. So he was eventually diagnosed with schizophrenia, I believe at the age of 17, 18. But growing up, being in school with him, I witnessed, people are awful, bullying, just the mistreatment that I had to witness with him. And then that innate need to be able to make sure he was safe and to protect him. I don't know where it comes from, but I think it's just a family, just a protection that is second nature. I'm a very quiet and reserved person, but when it came to him, absolutely not would I ever put up with or tolerate people mistreating him. So, I mean, if that's what I was put on this planet for, was to be able to, make it through life with him, then that's what I'm here for, because I love him, and he's in Southern California, but we talk, call him via text or chat on the phone, just to keep in contact with him constantly.
Very nice. Can we talk a little bit more about this topic, and especially from your state of mind, being an older sister, so you saw the bullying and the mistreatment firsthand, unfortunately, in school. What would you, I don't know, I would necessarily ask you what you would tell other children, but what would you tell parents that are raising kids in an atmosphere where there are neurodivergent kids, there are kids with all types of different personalities, some personality disorders, everyone's just different, but some people, there's definitely something noticeable in their behavior. What would you say to, your next door neighbor who has a child that's going to school? How would you tell them, when you see someone that's different, this is how you behave, or what you don't tolerate, and what you would do if there was mistreatment?
I think that we, as humans, compartmentalize people. We are all just people. We need love. We need friendship. We need attention. And I think that people forget that people with mental health needs or people that are special needs or able-bodied differently, that they're not human. I mean, we are all the same. I would just encourage parents that have children with special needs, or even parents that have children that are neurotypical, that keep in mind that everyone you approach, everyone that you encounter, they are at the root, they are just people, and you don't need to be afraid. I think a lot of times it comes from a point of fear of not knowing how to interact. I mean, of course it can be scary when you're, at the grocery store and someone comes by you and they're talking to themselves and those types of things. It can be startling, but 9 times out of 10, they're not there to hurt you. No, they're in their internal world. They deserve respect. They deserve the same treatment as anybody else.
Thank you so much for
Thank you for sharing.
Yes, and for reminding us to be compassionate. And are there any myths that you'd like to bust around children who are either special needs or who have mental illness?
They are so capable. That is a myth that I think a lot of people don't understand. They are so special in ways that typically family members that are around them get to witness, but other people don't. I mean, my son, my oldest son, Bradley, the one that I had young, we didn't find out until he was 19 that he has something called Kabuki syndrome, which is a gene deletion when he was, in utero. It was a fluke that happens, but he is so smart. I cannot tell you, if I ask him something that happened 8 years ago, he can tell you to a dime exactly what happened. So they are able-bodied in ways that we are not. They are special in ways that we are not, that neurotypical people are not. And I really think that there's a lot of strengths in our special needs adults and children that we could benefit from if we would just open our minds a lot more to what they have to offer.
Love that idea and that sentiment. So I hope we can pass that on for sure.
Yeah.
So you're a mom. You mentioned your oldest, but you have 3 boys, correct?
Yes, I do.
And you're this very busy nurse and nurse educator. So how do you balance parenting with everything else on your plate right now?
I cannot do it alone. My husband gets so much credit. He is my backbone. Very, very supportive, has been my cheerleader from day one. My husband was, my boyfriend. We had our son young, but we ended up making it through, and we've been together for a long time, married for a long time as well. But since day one, he's always really wanted me to do my very best. So we make sure that our schedules line up. He is a business owner, and he tries to make sure that his schedule works around mine. We still love to do the drop off. The boys can take the bus to school, but I love to be that mom that can drop them off in the morning and can be there when they get home from school. So that's the beauty of nursing education, is having those school hours for my boys. And then, I miss out on a weekend day, every now and then, but they don't know any different. They were born into mama's nursing schedule. So that's just how it goes. But that's really the only way I'm able to do it, is with support from family.
Drop off, great. Pickups were the best. There was a time where we had a babysitter, and then she wasn't able to pick up, adjusted my schedule, and just the best information that your kids can give you. So I appreciate that. And it's nice that you're able to do that. I know that you still probably like on the weekend days where or those days where your schedule doesn't allow and you miss events, how do you handle the mom guilt, or have you, do you have a way of preventing that in terms of how you process those misses?
No way of preventing mom guilt. It is a real thing.
Okay.
It is a real thing. I try to prepare them ahead of time. The worst would be if there's a big event and I tell them I'm going to be there and I can't.
Yes.
So I think that the boys knowing that I'm not going to be there makes it a little bit more okay for them, because I can't do everything. And then dad really tries to make it so that at least one parent is there with them. We used to have, their grandparents when we were in Southern California, and they really showed up as well. But now that we're, a smaller unit here, we just try to make sure at least one parent can always be present, and it's on video. Thank goodness for smartphones, because I
absolutely
can't be there in person sometimes, but I can hear it and I can see it.
You saw it. That's nice.
Yes.
Very good.
We have a few rapid fire questions before our last question, Kristin. So are you ready?
I am ready.
It's very important.
Okay.
Swimming or running?
Oh, man. Running now, because hair with swimming, having to do.
Love the authenticity.
Yes.
We are friends. I love it. Yeah. Okay. Now this is a tough one now. In-N-Out or Chick-fil-A?
Oh, In-N-Out. Through and through. Yeah.
That is definitely a California thing.
Yeah.
In-N-Out came to Dallas, and I knew about it because we vacationed in California, and wherever we were at the time, it was a new phenomenon, and we were like, what is that? Did we miss something here? But anyway, I get it. I always heard about In-N-Out when you go to California. Exactly. I get it.
Yes, absolutely. And then finally, podcast or book or ebook?
Podcast.
Okay.
Podcast. Yes, that's an easy one.
Right.
Yeah.
Very good.
Yep.
Well, good answer. We like that one.
Yes.
So can you tell us something about your self-care regimen, what it might look like now or what you'd like it to look like? And you're a dreamer, so what your dream regimen might look like?
I like that.
Oh boy, my dream regimen would cost a lot of money.
Bring it.
You need a partner in crime for that.
You know what's so funny?
Sylvia would be a good one.
You know what's so funny about self-care is that I guess we do things that we don't really realize are self-care. But I've listened to a lot of the ladies that come through on the podcast, and I guess the bedtime routine of doing all the things to our face, trying to maintain the youth as long as we can. So I've got about a 20-minute skincare routine at night. I used to love taking baths, but you know what? It would take too long. I'd be in there for hours. And so I had to kind of cut that because it was taking way too long. As much as I enjoy them, not anymore. And I'm like shower first and then soak in the bath after type of thing, My dream. You know how, have you guys ever seen how people do those schedules where they'll show like what they do in the morning and how everything is so perfect? If I could have a self-care routine, it would be getting up at the same time every day. I love a good schedule to the dot when it comes to time. So getting up at the same time every day, working out every morning, having my tea or coffee at a specific time, getting my boys in the car to go to school, just self-care.
Schedule.
I think to me, just having a schedule that I can follow, because if I can't follow a schedule, then I feel like my day is just, it's gone. So I think having a good schedule is self-care as well.
Nice. Again, another thread that sounds familiar when that one of the thoughts was, preparing your dream schedule, or what would your dream day look like? And actually having a day that completely follows that. Now, I still haven't seen that day come to fruition.
Me neither.
But, we can always set those goals, right?
Exactly.
Yes.
Nice. Very good.
Of course. I'd love to get my hair done every month. I'd love to get my nails done every 2 weeks, all those things. But alas, we've only got so many hours in a day. So someday that'll happen.
Soon come, as the people say, soon come.
Yes.
Well, Kristin Wagner, I cannot tell you, I'm so grateful that you were able to spend some time with us today here on Boss Lead. Is there a way in which people can follow? Is there some social media contact that you would like to share?
I really only have my personal Instagram. It's not very inspiring. It's just pictures of family.
That's inspiring.
It is.
Okay.
It's
no worries.
I will share it. It's QB, so QBEE with 3. Because I'm the queen bee in my household. I'm the only female.
Love it.
I like that.
Yeah, so QB with 3 for my Instagram.
Nice.
I'm not really active on TikTok or Facebook that much. I would get nothing done in the day if I was. So.
You're a busy lady, yes.
Exactly.
Doing great things. So,
yes,
we cannot thank you. And that was so nice to meet you. And I've heard so many wonderful things about you. Nice to know that there are, going back to the beginning of the interview, some very grounded, calm educators out there. I know that's how I was trained. I remember very well having a physician who actually delivered my babies, who was one of my attendings, and her demeanor in the emergency situation shaped how I treated patients and how I, was in the delivery room or and it makes the difference how you're trained. So it's very nice to know that, there are people out there that are making a difference in how healthcare is delivered. So we appreciate all that you're doing.
Well, thank you.
The future of nursing is in good hands. So thank you.
Yes.
Thank you for saying so. I appreciate you both so much for having me. Thank you.
Yes.
Thank you.
Until we meet again, may you be well. Okay, Sylvia, that was such a beautiful conversation with Kristin Wagner. Just nice conversation about life in general and humanity and taking care of patients, teaching other people to take care of patients. And I think we tend to overlook the impact that educators have on how we practice medicine, right? How we approach problems, solve problems. And it's typically those people that are able to problem solve without freaking out about things, and actually, have empathy for others that teach us the best. But just curious, in terms of pearls of wisdom, what your takeaways were today with Kristin?
Yeah. And I actually want to shout out one of our educators, Dr. Chip Reed, pulmonologist at Georgetown. And Dr. Reed taught me how to read an X-ray. And truthfully, also was the first time I felt confident standing in front of, it was a light box. Yes, I'm dating myself. But looking at an X-ray, and it was a life-altering experience for me in medical school. So it was so wonderful to have this conversation with Kristin, and knowing that she is a nurse educator, and she gave us so many pearls. One of my favorite, and I wasn't surprised to hear that she's a dreamer. And it reminded me certainly the importance of dreams, and we're planning our dreams so that they come true. And having a good skincare regime, and how she likes a good schedule. I was like, my girl, I agree with that.
Appreciate that. Yes.
What about you?
So I'm going to start with a shout out as well, because I don't know if I talked about this in the beginning, but one of my attendings, and when I started residency and who I actually chose to be my OBGYN was Dr. Manju Manga. Just beautiful soul, wonderful teacher. Everything, everyone's, freaking out. You've got a baby that needs to be delivered immediately. And she was the calm voice in the room that could walk you through things. And she's who I chose and who I kind of honestly patterned, my behavior after when treating, patients and in a delivery room where you need that calm voice so that everyone else knows, okay, we just have a job to do and get it done. So I'm going to do my shout out as well. I think from Kristin's takeaways, what I got was just humanity that's shown through her interview. And certainly I know you to respect her tremendously.
She's fantastic.
And having empathy. I loved her sentiment about, just curious, what can we teach our kids? I certainly, taught my kids or try to, when something's going on with somebody, there's always a story behind it. So, you have to give people grace, whether they're just acting out, they're being ugly, they're being mean, but certainly for special needs or neurodivergent people, I definitely feel like my kids picked up on those things, early in other people and were compassionate. So much so where I remember my youngest being very protected for a little classmate, like in the 4th or 5th grade. And she was just irate that someone would say something, mean to that person and came home and I said, well, that's a good thing. You also should talk to your teacher and let them know, what's going on so that they're the ones that can handle that. But having, compassion and empathy for others. And then I will echo you. And we talk to so many people that have someone in their life with special needs that a lot of people, everyone has a talent, a gift, whether it's just bringing love into your life and making you smile, making you giggle. But it's important to recognize everyone's gift, even though they may not be, traveling the same path as you. Everyone has a gift. So those are my takeaways. That was nice.
Well, we want to thank everyone that listens in advance. Please share, subscribe, like, follow. You can contact us at bosssleeppodcast.com, and we look forward to hearing your thoughts. And until then, may you be well.
May you be well.
That's a wrap on another episode of Boss Sleep. May this conversation enlighten your path toward personal growth and professional empowerment. For more thought-provoking and eye-opening discussions like this one, head to our website at bosssleeppodcast.com. Always remember to celebrate your wins and trust yourself. A positive mindset can push you out of your comfort zone and into far greater heights. Until next time, may you be well.
Before we go, there's one more thing the lawyers have asked us to include. It's the legal language, and you know how doctors love lawyers. This podcast is presented only for educational and entertainment purposes. Although we are doctors, on this show, we are just your friends. This podcast is not intended as a substitute for the advice of your physician, professional coach, psychotherapist, or other qualified professionals. Understood? Awesome. We'll see you in the next episode.